Well, joining us now for more on this is Richard Dykes, Principal of Nelson College. Hi Richard, thanks so much for coming on.
Well, Maria, good to hear from you.
So are you seeing your team struggle with vaping addiction?
Look, it's I've talked to a lot of colleagues. We're a bit of an anomaly in that we've seen our vaping numbers go down. But look, the reality is, if you compare it to 5 years ago, absolutely, it is higher, and it is it's a bit like deja vu. You know, 15, 20 years ago, we were fighting the good cause against cigarettes. We seem to be winning that. We thought the game was over. Now it's vaping.
It's the new smoking, but worse because there's more nicotine in vapes, isn't there, than smokes?
Yeah, look, I'm not an expert in terms of the actual numbers, but my understanding is that there's quite a range of products, and when the students are vaping, they're getting a lot bigger hit than they might do if they were just cigarette smoking.
Okay, so what do you do when you catch a kid in the bathrooms vaping?
Look, there's going to be a range of solutions, and it really depends on the student. You know, if you go back 3 or 4 years, we were quite severe. It was a bit of a minority thing, and we took it quite severely. Then it got to the stage where it was just becoming so rampant that we couldn't literally stand down or suspend every student. So, you know, we might detention, but I suppose it's really trying to have that conversation with them and the whānau about what's going on. But then there's a spectrum of students. You know, there are some students who are seriously addicted, and you know, look, punishment is not the solution for them. It's about working with them through counsellors or guidance, and saying, how do we get you off this, this addictive substance?
And so, how many vape shops are near your school? Because I know that's a big contributor, isn't it? Just the availability; they're popping up everywhere.
Look, it's just crazy. You know, I think, you know, if there's a common theme amongst principals, one is that level of addiction that you just talked about, and second is it's the easy access, whether it's online or whether it's at one of the tsunami of vape shops that are downtown.
And what about the flavours? Because we see all those strawberry, melon, sherbet. You know, it seems like a lolly. It's really targeting kids, isn't it?
I've heard Coca-Cola's going to release a brand soon. Look,
hope not.
Yeah. I suppose I use the analogy of it's a bit like the RTDs that came out quite a while ago. You know, they're really sweet, they're really easy for students to drink. Similarly with vaping, it's very child friendly, and that's the trouble. It's very alluring and very easy for young people to get into. Okay,
so lastly, let's talk solutions. Would you support a ban on recreational vaping? Make it purely a tool for people who need to quit smoking, where you'd need a doctor's prescription?
Yeah, look, I think the debate is around, is it a cessation tool or is it something which is addicting new people? And, you know, what we're saying is that we don't want young people new to vaping be that collateral damage to a genuine smoking cessation program. So somehow we've got to restrict the access. We've got to get it out of off the main streets. But at the same time, we've got to get it to those people who are genuinely in need.
So prescriptions or no prescriptions? What do you think?
I'm not really fussed. Whatever way, we need to get it away from the young people and we need to get it to the people who need. So whether that's by prescription, whether that's through whānau-based or iwi-based local community health programs, whatever's going to get it to the people who need it with proper wraparound service, that's going to work. But keep it away from our rangatahi.
Yes, and get it into a health setting. OK, I hear you.
Totally.
Richard Dykes, Nelson College Principal, thank you so much for joining us.
Very nice. Good to see you.